Hello, everyone. It's been a week. I missed you all last week. Good afternoon or good evening or good morning down under. Welcome to the 65th episode of SADS Facebook Live and whatever social media platform you're joining us from. Great to have you. On behalf of the CEO of the Sudden Arrhythmia Death Syndrome Foundation, the SADS Foundation, Alice Laura, welcome to the program. I'm Mike Ackerman, genetic cardiologist at the Mayo Clinic in Rochester, Minnesota, and director of its Winland Smith Rice Genetic Heart Rhythm Clinic and the Winland Smith Rice Sudden Death Genomics Laboratory. I've been a partner with Alice for many years now, serving as president of the board, and we have really enjoyed our year plus together doing this. I can't believe 65, and now even with a break, a 1 week break. I hope you enjoyed the week off. The pandemic isn't over, so stay reminder, doing the things when you need to, but let's apply science. Wear the mask, but when I'm in this office alone, guess what? I don't have the mask on, and I can't wait until when I'm in my patient office with my mask on and my patients, and we discover they're vaccinated, I'm vaccinated, to get the mask off so that I can enjoy all of my patients' face. We're not there yet at our medical institution or many across the country where they're still having us mutually masked in the patient room. But progress is being made. 135 million of us in the United States are vaccinated. As you know, I got mine. My wife now has hers. 3 of our 4 children have been vaccinated. One of them is still thinking about the pros and cons of it. So I know all of you out there, you may be wondering about it and thinking about it. If the reason that you've been vaccine hesitant is this concern about fertility, I get it. My daughter was reluctant after things she read, tried to teach her and show her that it really has been one of the cruelest vaccine hoaxes or anti-vaxxer strategies out there. Mayo Clinic debunked the myth back in December, but I've had many patients, 10, 20, 30, 40 women in a row, all offer me in the last 2 months that reason. And so if you're wrestling with it for that reason, I can only encourage you that there's just no evidence there. I would never have encouraged my daughter to get the vaccine if I thought there was a shred of evidence about that, because I want more grandchildren. Speaking of grandchildren, how did you like that for a segue? There she is, and I'm going to see her tonight. Jaden is coming for my baby's high school graduation. So our 4th child, Grace, graduates from high school tomorrow, and so we're having everybody together. And if you haven't seen her, this is her without the sunglasses. The sunglasses one is my wife, but Grace graduates tomorrow from high school. So our 4th and final high school graduation. Well, that's our preamble update, and we're really excited for our topic of today. This is National CPR and AED Awareness Week. We want our families to know CPR. We want our families to know about an automatic external defibrillator, to possess one as part of family safety gear. But I also want my families to know that I expect you to never have to use it. Now, even though I say that knowing that just yesterday, one of my patients, a child with long QT, needed CPR from her sibling, did not need the AED because the long QT broke through the therapy. So we need to be prepared. Boy Scout, be prepared, or Girl Scout, I think that's Girl Scout, be prepared with that. And I can't think of 2 better people to join me than really a special friend in Brynn Dechert, who is on the board of the SADS Foundation. She's a nurse practitioner at the University of Michigan. She's a Wolverine. So Aaron is going to bring Brynn on to join me first, and then we'll be joined a little bit later by Adrian Olmos from the company called LifeSure, who we introduced to you a year ago. So Brynn, bring her out of the bullpen, and she is coming up right now. Hi, Brynn.
Hello. Thank you so much for having me today.
It's great having you back. I think this is a return visit. So thanks for gracing us with your presence, and really appreciate all that you do for your families in the Michigan area and for the SADS Foundation. But our topic of the day is CPR. But before we do CPR, let's do Brynn Dechert. Give our friends out there a sense of what you've been about and a little bit of thumbnail sketch of your journey from here to there.
Sure. I'm a nurse practitioner, like Dr. Ackerman said, at the University of Michigan here in sunny, beautiful Ann Arbor today. I was born and raised here. I went to college at Michigan State, so I have a little green in me as well. I know that's a big deal.
Yeah.
And I went to grad school at Loyola in Chicago, and that was where I had my first nursing and nurse practitioner job at Lurie Children's. And I moved back here to Ann Arbor about 14 years ago when my son was 1. And I have a great team here at University of Michigan, and I have been part of the SADS Foundation for at least the last 7 years. I can't remember exactly when, but thrilled to be part of this group and love working with the SADS Foundation as well as the families and patients that are part of SADS. And speaking of my son and vaccinations, today he got his second COVID vaccine. He's a 13-year-old, so he was able to get the Pfizer vaccine. And I will say he is doing great. I'm very proud of him. And he is up in his room in school. We're still very virtual here in Ann Arbor, but he's doing great.
Brynn, I'm curious, have you seen that same thing that I encountered, that I send out the alarms about the young women being so hesitant or fearful because of that fertility thing?
Yes, I just was asked about this yesterday in clinic. I had a 20-something-year-old that is, married and thinking about having children, and she asked me about it, and I said the same thing that you did, that there's no data. I don't have any female children, but if I did, I would encourage my children also to have this vaccination.
Well, University of Michigan has a special place in my heart because, as you know, you hosted one of our SADS family programs now 4 years ago.
I think so. I think 4 years ago. Yeah.
So Brynn brought me down on the football field, and one of the families, and you know who you are out there, challenged me to see if I could kick a field goal, and I did it.
You did. It was amazing.
That's the closest to a cheering crowd of fans that I've ever had. So that was a little fun evening that I'll never forget. And thanks to you for all the work you did putting that program on. And hopefully we will have another SADS family program again. 2021 got squashed. We got third time as a charm in Houston with our friends down there. But what, as we think about CPR, and as I said at the intro, that we want our families to know it and to know how to do it. We want them to know, though, with a lot of confidence, that if we have their genetic heart disease treated well, it will be far more likely that they'll be using CPR on their coach or the referee or the principal or the grandparents coming to watch whatever they're doing, rather than thinking that the mom and dad are going to be doing it on their child with that. Is that a challenging message, do you think, sometimes, where we want them to know how to do it, but you probably won't ever need to use it?
Right. It's the same thing. I think we'll talk later about AEDs. They are a safety mechanism, and AEDs are in the schools, and the statistics show that they're most likely used on a grandparent who came into school, a teacher, someone else, not the children there. But we want schools to be prepared and the general public to be prepared. So knowing how to do high quality basic CPR will keep people alive. And that's really important on an airplane, in a gym, in a store. We don't want people to be afraid to go and help out to save a life. We know that CPR works. There's been a lot of changes in basic CPR over the years, and the messages that we have given families. As you all probably remember, there was a lot of mouth-to-mouth concerns when you were, if you don't have a barrier. And now the American Heart Association actually promotes high-quality chest compressions, and they've taken out the airway part just because it was confusing and made people very nervous. So the key is high-quality compressions, and we'll get to that in a little bit. But that's the key point with the current recommendations for CPR.
Brynn, I'm curious, outside of the hospital, have you ever had to do it yet?
I have not. I've had to do CPR in the hospital several times, obviously, but I've never had to do it out of the hospital. I have not been the person on the airplane. Is there a nurse or a doctor here? But I'm thankful for that. But I continue to keep staying prepared. I renew my license every year for CPR. And I someday I might use it, but honestly, I hope I don't.
Yeah. No, and I haven't either. So I haven't, but and so the family who called me yesterday, who I'll be joining on a call right after this, their high school child did it on their little sister. And so the did it is pretty easy, isn't it? So why don't you mentioned that it's kind of the breathing thing is not part of it. It's good chest compressions only. And I think you have a little
friend, yes,
friend who's volunteered for you to press on their chest.
That's right. I have a CPR friend in front of me. I'm just going to start with a few things. The American Heart Association does recommend CPR without clothing, and that is one of the worries that many people have about taking off clothes, especially in public for women. And what we want to remind everyone is it is okay to do CPR with clothing on. The faster you can get to the chest, the more likelihood of survival. So if you don't have scissors or you can't figure out how to get clothes off, just start CPR. And the easiest way to find the place to do where you put your hands is by actually going up to the armpit and then moving your hand over to the center of the chest. So it's mid-nipple line is where you start your compressions. And then you don't have to be finding the placement there if you use the armpit to get there. The other thing that's very important is hard and fast. You want to push hard and you want to push it fast. You want to push at a rate of about 100 to 120 pushes a minute. And this is very important because people think they're going fast enough and they're not. And you want to push as hard as you can as well. So we recommend 2 inches of compression with a recoil of the chest. So I'm going to move my camera here and go down to my table. And I'm going to turn my camera away from my face, and you can see my friend here. We'll name her Annie. There's usually CPR Annie. You usually want to have the patient on the ground. I'm using the table just because it's hard to be on the ground. And like I said, when you see someone that's down, you would go over to them and say, "Are you okay? Are you okay?" You look for signs of breathing, which is usually, the rising chest. And if you don't see rising chest, and you check up, and you can actually just start your CPR right then and there. So here I go with the mid-nipple line. I'm going to interlock my hands. It doesn't matter which hand is on top or bottom. That's up to your comfort. And you start pushing as hard and fast as you can. And the way you know that you're pressing fast enough is there's a song that I was worried today, Dr. Ackerman, that many people may not know because it's an older song. I know the song, but it's Staying Alive by the Bee Gees. So the staying alive, staying alive, staying alive, staying alive. And that's about the right rate that you would need to press down on your patient or your family member. The other thing is, as you can tell, just by doing that little bit of CPR, I'm already winded. It is very hard to push down on a patient, and you do get tired after a while. And so that's one of the important things to remember is if you have bystanders with you, to switch out when you start getting tired. And that's usually about 2 minutes of CPR when you would want to switch to another person. So again, I'm going to push hard and fast.
Staying alive.
There you go.
And I could go really fast, like 2x.
Exactly. Exactly. And honestly, the faster, you don't want to go, you want to have recoil of the chest each time, but you think you're going fast enough, you probably aren't. So if you think you're going fast enough, go a little faster. If you're thinking going hard enough, go a little harder, because that is high quality CPR. And that's what we need for survival. So I'm going to move my computer back up.
That was fantastic, Brynn. But that's fast, isn't it? Two compressions every second.
That is right. So it is fast and it is hard work. Dr. Ackerman, we were talking about, have I ever done CPR before? And I've only done it in the hospital. And even in the hospital, I would switch with my nursing colleagues every 2 minutes because you really do get winded. So even if you have to talk someone else through how to do it, say, hey, can you just come help me? And they say, oh, I don't know how to do it. I don't know how to do it. I'm not certified. You say, I will help you. I will talk you through it. You are with them. You tell them what to do. You can sing the song just like Dr. Ackerman did for me to get them to push harder and faster. And involve as many people as you can. You can help coach them through. And that's the important part.
That was great, Brynn. And Gwen is offering us another song, which honestly, full confession, I've never heard of this one, the Baby Shark song.
Oh, do, yeah. Baby Shark, do. Yeah, so there's those songs are out there as well. Like I said, as I was thinking about this today, Staying Alive is becoming a really old song. I think it was out there in the 70s. So there may be young people who don't know that song. Baby Shark, as Gwen said, might be a little bit more contemporary for the audience out there. But either one works. I'm going to go with Staying Alive because I remember that song.
Yeah. But right when we're done, I'm going to have to Google the Baby Shark song to see if I like that song.
There you go.
So
there you go.
Gwen. But Brynn, on that CPR, so what if I'm afraid as the bystander that I'm going to break their ribs? Does that happen very often? Am I in trouble if it happens?
Right. Great question. This is one of the reasons why people are afraid to do CPR. And one, it rarely happens that you would injure someone, breaking a rib or something along those lines. Secondly, we're talking about life and death here. So you want a patient to survive. If for some reason a rib breaks, that will fix itself. There's nothing to worry about. You want to save a life. No one will get in trouble or have any sort of legal issues if they are performing CPR and injure someone. So I do not think that's a concern and should not be worried about for CPR. You are saving a life.
And what happens if I'm doing the Baby Shark thing and somebody else comes along and says, hey, I can breathe for you because they remembered this old thing about breathing? Sure. Is it better to add them to breathing, or isn't it better to just say, no, thanks, I'm going to need you to switch out with me?
Yep, that's what I would say. That's what I would say. The breathing, so most cardiac arrests, most arrests or most patients that you find down, it's heart related. It's usually rhythm related, or ischemia, meaning no blood flow. And so what you want to do is get that blood flow pumping. That's the most important thing. And if you remember, however long the patient's been down, prior to that, they were breathing. So there is air in the lungs. There's oxygen in the lungs. You want to circulate that. So if someone asks and says, oh, I can do mouth to mouth, you say, nope, can you please stay here with me? I'm going to switch out in another minute, another 30 seconds. I'm going to need your help. And then, you can also have that person, the second person, please go call 911, or, that's usually already been called, or get an AED. Find the AED. If you're in a gym or a school, find the AED and bring it to me, because that's also very important. Right.
And we're going to come to the AED real soon. But before we reach the AED, you had mentioned that, a lot of the education and what SADS does also is heart safe schools. What are some of the key elements that a family could know that school is a heart safe school?
Sure. So Heart Safe School is preparation. It's preparation for someone having an arrest in the school. Think about this. It's a fire alarm. It's a tornado alarm. We still in schools practice tornadoes, which I have never been a part of. The rate of school fires is very low. And, now we're talking more things like heart safe schools, as well as, active shooters. So these are the things that we've recognized we need to know and be prepared for. This should be just as important as the fire drills that you have in your elementary school or high school. And the school is able to practice what would happen. They do drills if a patient or a child or someone in the school were to go down, and you need to know where the AED is and what to do when that happened. There's no, not everyone has to be certified in CPR or AEDs, although most teachers are. We want everyone to react and everyone to know what to do. And so this preparation is very important. Dr. Ackerman started today with talking about being prepared, and that is the most important thing.
And you said not everyone has to be certified. We're starting to see some states, mostly as unfunded mandates, but some states saying that as a requirement of high school graduation, everybody should be CPR certified. Do you know the number that we're up to now? I don't.
I don't know either, and it is something that they learn in the schools here in Michigan, and they're not certified, so they don't walk around with a basic life support card as many of us medical professionals do. But it's, again, just preparation. It prepares high school teenagers to know what to do in an emergency, hoping that they won't need it. But as they age and continue to practice or think about those skills that they will need going forward. So it's very important to have kids know what to do. And again, you don't usually use it on a young person in your family. It could be a grandfather, it could be a neighbor, it could be a mailman, you could be in church, and it could be someone there. There's lots of people that are out in the world that need our help for able-bodied people to be able to perform CPR whenever. And the important part too is Heart Safe Schools comes from Project Adam, which I think we're going to talk about in a little bit. But it's important to be prepared and practice for these schools and the people that go to the schools. Whether it's usually not a child, like I said, it's other people that are at the school.
Robin shares with us, Brynn, that the lady who gave her CPR went on for 8 minutes before the AED arrived, and that the rescuer said she wasn't going to trust anyone else to give her that CPR, so didn't swap out. Well, that's incredible. I think, like you showed, it's really important to go pump hard, and Robin got a great rescue result. But it makes me ask the question, you're doing that CPR, you found somebody down, you have a bystander to help you trade in and out. When do you stop?
So I would stop if everyone is physically exhausted and can't go on. You just can't go on, or when a medical professional arrives. So it's EMS. I live in an area where EMS is readily available and only takes a few minutes to get there. Obviously, in other areas of the country and internationally, they may not have a rescue team that can arrive quickly. But I would go as long as you can. As long as you can safely do it where you're not hurting yourself or, feeling physically exhausted, or until a medical professional arrives at the scene.
Yeah, thanks. And hopefully the medical professional or somebody from the school has run in or run out and brought that thing called the AED and the automatic external defibrillator. And let's bring on Adrian Olmos as we talk about Project Adam. And so tell us a little bit about Project Adam, Brynn, to set the stage, and then I'm going to chat with Adrian and have you and I talk to him.
Great. So Project Adam is a national program. It currently has 28 affiliates in 23 states. It was started in Wisconsin. It's named after Adam, who was a child that had a cardiac arrest. In his honor and memory, this project was started to train people on the use of AEDs across the country. Project Adam also is the place that you would go to have your school become a heart safe school. Again, it talks about AEDs and plans for those schools, and many schools are certified. I do not have the number of schools across the country that are certified, but I know many of them in Michigan are, and it's something that we discuss at the University of Michigan very often. So many of our SADS Foundation members or prior board members are part of Project Adam. Stu Berger is the director of Project Adam, who had been on the SADS board, and now is the division head of cardiology at Lurie Children's. But Project Adam is a very, very important organization. And if you wanted to look up more information about Project Adam or Heart Safe Schools, there will be information at the end and a website that you could go to.
That's great. And I know you do like I do. So I have recommended that everyone in my family, for the children, not for adults, we could talk about that, but for children, that they get an automatic external defibrillator, an AED, as part of their safety gear, just like some of my colleagues recommend that the peanut allergy family gets an EpiPen as part of their safety gear. And I have found this company called LifeSure to be a treasured resource for these families. And to talk more about LifeSure, I'll have Aaron bring on a friend of ours, Brynn, that you and I both know and work with, Adrian Olmos. And just full disclosure, I am not a consultant for LifeSure. I receive no royalty, consulting fees, nothing. I use this company. Technically, they're not a nonprofit company, and Adrian will give us a little peek into what LifeSure is. But I would have to say, at least for my families, when my nurse Michaela connects the family to LifeSure, we get an AED, or they get an AED for our families with, I think we're at about a 90-95% batting average. So it's incredible. And so Adrian, on behalf of my families, where you've helped us get that safety gear for that family, that peace of mind, the fire extinguisher equivalent, thank you. So I'm so grateful for you, LifeSure, and your partnership with the SADS Foundation. So before you tell us about LifeSure and its mission, let everybody know a little bit about Adrian.
Fantastic. Thank you guys again for having me. So I had to do the math on my calculator because it's been a while. But right out of high school, I became an EMT. I did that for about 9 years, and it's kind of buried way back in my past, my resume and all that. But I did that for 9 years. I also worked in an emergency room for 3 of those years, kind of simultaneously as an ER tech, doing EKGs, pulling blood samples, phlebotomy, things like that. And then I got the itch to get into workplace compliance. So I worked for a big company, did that for a while. Then really fell in love with AEDs and CPR, and I was an instructor since my EMT days. So about 27 years ago. And I went to work for a medical device company that actually is one of the major manufacturers for AEDs. Did that for a while and got to place AEDs in the workplace. So I'm very familiar with that. And then I went into another company that you're probably familiar with, that that makes a wearable AED. And did that for a while. So I got my feet wet with the DME. And then I got the call to come over to LifeSure, and this has been an amazing journey, and it's almost 2 years, and just the impact with the families. And even when I do the virtual training with them, it's amazing when they understand, because I try to talk in layman's terms on how to use the AED and not get too technical, because a lot of these terms and phrases are swimming around in my head, but I try to just get to the nuts and bolts of it, and just explain it to them in the easiest way possible. And when they repeat it back to me and they understand it, it's amazing. And like you said, definitely like a fire extinguisher, we hope they never use it, but that they have the knowledge and they have the confidence to use it. That's really what we're after. So
tell us a little of the mission of LifeSure. So I know a year ago I caught a little flack, just tiny, because during National CPR and AED Awareness Week, I introduced LifeSure as a nonprofit company, and it turns out that I was wrong. I hope LifeSure makes an unbelievable profit, because you've earned it with all that you all do to help our families get these devices. Because pre-utilizing you and LifeSure, we basically left our families. I don't know if you found the same thing, Brynn, that you were doing, where we just would say, it's a good idea to get an AED. I like it. I like the concept of it, and do your best to get it. And which one? Well, whichever one you can get. Where can you get it? Go to Sam's Club, Costco. You can Google it. You can order it, and just see if you can make it happen. That's what we did. Now all we do is we say, we have this resource that we utilize, and they will do all the work, all of the work, and they will almost always be successful. And maybe our 90-95% isn't your industry average, so I don't want to set expectation too high. But how is LifeSure doing all that you're doing? What is LifeSure? the mission, and what is the success rate in getting this?
Great question. So yeah, right up front, we are not a nonprofit, but we don't charge the family any service charge or any fees for our service. What we collect is basically what the insurance agrees upon to pay out. The only time we have to collect is if there's a co-payment, but kind of like if you had to go fill a prescription for a medication or things like that, you would pay that. Other than that, we don't charge them anything else other than what the insurance reimburses us for. So our mission is basically to get the AEDs in the hands of the high-risk patients that if a doctor prescribes you with an AED, then we'll take it from there. So we'll definitely work with the healthcare providers, doctors, nurse practitioners, PAs, whoever it is, and we'll do all the legwork. We'll contact the insurance, we'll gather all the documents, package it all up, submit the claim, and then go back and forth with the insurance company. And sometimes that's in the form of appeals, sometimes 3-4 appeals. It takes a while, but we definitely exhaust all of our avenues that we can until we get an authorization. And on the off chance we get a denial, we do offer them for sale, and we do have recertified units. But what we lately we found out from one of our patient families is she found a grant, a mom of one of our patients, that she applied for, and all of a sudden we get in the mail a check, and it's for a patient that got denied, and through the grant they were able to get the AED free of charge. So we were able to do that too.
And Adrian, your timing was incredible on that, because Cassidy just chimed in that LifeSure helped us too. Insurance initially denied our AED. We applied for a grant and we were approved. LifeSure was so wonderful to work with. So we need to help the families get the word out on whatever this grant mechanism is, because sometimes even when you guys exhaust all means and the answer is no, no may not have to be the final answer, but you're incredibly tenacious at LifeSure because you won't give up. That's what we've seen. Brynn?
Yes.
So I just say it all happens. So I get my Michaela, she gets LifeSure, and then I get this note from the family's got our AED.
Yep.
But you have Adrian now right before you, and you're the one doing what Michaela does.
That's correct. Yep.
Is there anything that you want, since we have him, that you want to make even better in the exchange with how you guys utilize LifeSure?
I find it very easy. Adrian and I have worked together for the past couple years, actually, and it's the same. There's same things that Adrian needs each time. And so we basically have a template that we know to fax it to him or email it to him, and then he contacts the families. I always tell my families, you're going to get a phone call from LifeSure. This is a company that we support. This is how we get our AEDs. And it just like Dr. Ackerman said, there were times in the past when I've been doing I've been working in EP electrophysiology for the past 17 years, where it was me that was calling the insurance companies, writing the letter in the middle of clinic patients and things like that, which is very challenging. As Dr. Ackerman knows, we have a very busy clinical schedule, and it is so wonderful to have Adrian and LifeSure who's able to do this work for us to get the families the AEDs. Adrian, what do you think? Do you think it's easier nowadays to get approval from insurance companies, or it's stayed the same, or it's every insurance company is different?
Every insurance company is different. The carriers, the level of plans, the level of coverage. But I know, and I appreciate you guys giving me all the praise, but it really goes to our staff back in Miramar, Florida. This team of ladies, sometimes they're on the phone with a representative from an insurance company for 45 minutes to an hour. I mean, and to your point, Brynn, you guys don't have time for that. So that's what we like to do, is take all of that off of the plate of the families and also the healthcare providers, so that you can go back to doing what you guys do best and not have to stay on the phone forever with an insurance provider and find all the paperwork and submit it all. But it really depends on the level of coverage. But I will say our success rate definitely is because of our personnel. They know kind of, when we get an insurance, we see the face sheet and we got the demographics. We're like, okay, we know what we're up against with this insurance provider. And that's why, and sometimes I get the question from healthcare providers, they say, why do you need so much information? And we say, we like to give them as much as we can so that we do it one time and then we go after the appeals and all that. So we're not kind of piecemealing it and then delaying the claim. So that's part of our success too, is knowing what we're going to need and getting that right away and kind of going through the channels. Success rate, I think last year we were at about, because of different circumstances, different providers, things like that, we were probably about 80% success rate, which isn't bad, which is really good, because again, we do exhaust all options and then do offer the refurbished. And if there's a grant, or sometimes the hospital has a grant or a physician fund, that they'll find some money that way too. So we're definitely, whatever we can do, however we can help, we'll reach out, and I'll make phone calls, and again, our staff is really amazing.
It's kind of one of those good news, bad news things in the sense that we have made it a bit harder, I would say, for the insurance reimbursement argument, in the sense that we hardly ever need these, quote unquote, right? So my total in 20 years is we've had 4 of my children out of over 600 treated children, now probably 700, 4 AED rescue shocks, and 4 children in 7 years. So insurance companies see that and they say, where's the medical necessity? And without them seeing, wait a second, you measure medical necessity, you can't put a price on the peace of mind that the family has, knowing that when they're out swimming at the lake, the AED is there. When they're out somewhere together as a family, enjoying family, and there's no way a first responder is going to get there in 3 minutes for worst case scenario, the families have peace of mind. And so insurance companies better be assigning value to the peace that this fire extinguisher provides, even if I don't ever have to, what is it? Squeeze.
Yes.
The pass method. Yep.
Yes, pass
method. So I know the drill, I may never have to exercise the drill, but the peace of mind is priceless. And so hopefully, if you need our help telling the insurance companies that, but at 80%, it seems like your pit bulls of tenacious workers on the team, they must have the drill down without need of much help. They're incredible. So thank them from us.
Adrian, I have another question for you. Do you help the families with the upkeep? So, new batteries, new pads, and things like that. I know you do, but I just wanted to maybe lead into that a little bit about how easy you make things for families when they receive an AED.
Absolutely. I don't know how it was in the past before me, but I know since coming aboard, our parent company, One Beat Medical, they've got the pads and defibrillator accessories for all devices that are out on the market. So sometimes even if we didn't assign the AED to them or it didn't come through us, we can get supplies through our parent company. So that's a great help, but we definitely stay on top of that. I let them know you're going to hear some alerts from the AED when it's time for some maintenance. Definitely check it once a month at least. Look for that green flashing light or whatever the indicator lets you know that the AED is ready to go. But if they do need supplies, they can definitely come back to us and get the supplies. Sometimes, it's reimbursed through insurance. Sometimes they buy them and then reimburse on their own. It just depends on their plan and their level of care as far as their health insurance.
So you've made it really easy for Brynn and me to get this piece of safety gear for our families. But how about for when the families receive it? So they say, yeah, I've got this thing, but nobody showed me how to do it, and I'm scared to death that I don't know how to do it. I think you also take away that anxiety by giving them the drill, right?
Absolutely. So we offer free virtual training for all of our families that get an AED from us. Sometimes people take us up on it, sometimes they don't. And I'm the one that does all the calls. So if you get a phone call from me or 7 messages or whatever it is, I go through the drill. But then we'll schedule, either over FaceTime or Zoom or whatever method is going to work out for the family. And I'll take, usually it's about 15-20 minutes, but sometimes the family has more questions and sometimes they make it a family thing and I'm on a big screen in somebody's living room and they got all the kids out there and everybody wants to ask questions, and I welcome it. This is their time to ask me everything they want to know about AEDs, about CPR, any questions they have, just to get over that fear. And then once I see that tension in their face and their shoulders start to relax, I know they're getting it. I know they definitely know they have a source for us. And even after the training, I say, look, now you've got my cell phone number because I've called you so many times. So definitely reach out. You have our office number, but if you have questions and there's something you forget, a day or two later or later on that day, no problem. I'm on the West Coast. So for the East Coasters, sometimes, they want to do the training later in the afternoon. It's still early for me, so it's no problem. And I've also done weekend trainings too, because sometimes with scheduling, it's just so hard. So I try to be as accessible as I can to the families, because I know this is important to them. And I know relieving that tension and that apprehension about using it is paramount. So.
And that's where I got a little bit of trouble last year, I think, because I said, ultimately, don't worry about it. They're so easy to use that flight attendants know how to use them. And people said, what? And I said that in joke because my wife is a flight attendant, was a flight attendant. But there was that demonstration, right, that these devices are incredibly easy to use. But last thing, and I'll let you go. We said that our patients and our families may never need it, which is great. And it's a peace of mind that's beyond value. But the AEDs in the public square, Brynn, they work, right? I mean, it's been pretty dramatic as to the number of life saves tallied by Project Adam. The idea of having AEDs in the casinos, in the airplanes, at the airports, in the public square has been a life-saving idea.
Yeah, I agree. The other thing that the AED is very helpful with is it does have a little chip in there that records the rhythm when the AED is applied. And so we have been able to get that information from a medical standpoint and use the information that's on that for sometimes diagnosis or even, figuring out what it is. So it's very important last year I had this story where a couple years ago, actually, one of our patients had an arrest on a beach, and they packaged up the AED and sent it to us to take out the chip to use it. It was covered in sand when I pulled it out of the box, and so it is very important that that we can get that information, and it does save lives. We have a lot of patients through the work of Project Adam and SADS. AEDs are everywhere, and we use them when we need them.
And I want to thank both of you. And I want to just add, Cassidy, thanks for the follow-up. So if by chance you're a family trying to get an AED and LifeSure, despite 3, 4, 5 attempts, aren't convincing the insurance companies what ought to be obvious. Insurance companies, are you listening? What ought to be obvious? The grant that she was referring to try is United Healthcare Children's Foundation at www.uhccf.org. So United Healthcare Children's Foundation, if you're watching, thank you. Thanks for providing that grant mechanism that helps get that 80% number higher so that all of our families who want an AED, who want to follow our recommendations to acquire that safety gear for each of their children who may be at risk, I thank you. Brynn, thanks to you. I so value what you bring to the SADS Foundation, to PACES, to all of our families, and for our friendship. I appreciate you, Brynn. And Adrian, please extend the deep thanks to that team of, you said ladies, so I'm presuming the young women and the old women and the whatever women in that room who just do not give up until they secure that AED for these families. Thank them for us, would you?
Absolutely, absolutely. And thank you very, very much for your support, your referrals. We love working with your families. Your families are amazing. And anything we can do to help, just call.
Thank you.
Will do. And to all of you out there, join us next week. I told you tomorrow my daughter graduates from high school, but next Friday, we're celebrating the graduation of our SADS Foundation graduates. So all of you out there, if you have your son or daughter graduating from high school, college, and want to be celebrated and recognized, we would love to do that next Friday, and I'll take your questions after that graduation celebration. So join us next week. Until then, have an incredible weekend. I sure will be. Grace, my daughter, congratulations. See you, everybody.